Welcome to Health Talks. Hello, and welcome to Health Talks. I am Shona Daily-Germino, board-certified nutritionist and practitioner and founder of Dietary Pathways. Today, we're going to talk about cardiovascular disease. This is a new series I've put together to discuss a wide range of health issues. Each presentation is short, but full of important information. Today, we are discussing cardiovascular disease. Cardiovascular disease affects more than 80 million people and is one of the leading causes of death in the U.S. What does this really mean, and why should we be concerned? These are all good questions, and I hope to explain this in this series. There are 4 chambers in the heart, also the aorta, blood vessels, and arteries. The blood moves and circulates through the body. Your heart has a huge job to do and works all the time. For a fist-sized muscle, its sole purpose is to circulate blood and beat. How often do you think about your heart? Do you think about preventative care? Risk factors such as smoking, drinking, high blood pressure, stress, diet, exercise, your environment, energy drinks, and also any recreational drugs are all risk factors for developing cardiovascular disease. Another factor that should be noted is if you are at risk due to hereditary reasons. If cardiovascular disease runs in your family, you are at a greater risk. Therefore, preventative care should be a top priority and protecting your heart. What can we do to protect our heart? And what can we do to reduce the risks? Talking to your doctor should be the place that you start. Also looking at your diet, looking at low-fat diets, diets that are high in fiber and low in sodium. Also diets that contain good fats, such as avocados, olive oil, and coconut oil. And diets rich in leafy greens and avoiding alcohol all help keep your heart healthy and pumping. Your heart has a humongous job to do and is a vital organ to your health. Plant-based diets contain vital nutrients and antioxidants that help protect the heart. Healthy carbs, such as oats, veggies, should also be incorporated into a heart-healthy diet. Calcium-based foods, along with folic acid, vitamin D, and omega-3 fatty acids that are found in fish, contain nutrients that help not only heart, but your whole body. Do you know the signs of a heart attack? Symptoms of a heart attack are different for men and women. The warning signs include pain in the chest, jaw, or arm, hard time breathing, headaches, sweating, nausea, dizziness, and weakness. If you are experiencing any of these warning signs, it's good to go and get checked out by your physician or the emergency room, especially if the symptoms persist. Talk to your doctor to develop a plan that works for you. Have your A1C checked regularly and see if you have any other risk factors such as diabetes. This is a picture of an artery. HDL versus LDL. HDL is your good cholesterol that protects against cardiovascular disease. LDL is the cholesterol that clogs your arteries and builds up plaque that sticks to the inner lining of the arteries. When these are blocked, the blood cannot flow freely, and this creates a blockage. Heredity plays a huge role, but does not guarantee you will develop cardiovascular disease, especially if you take preventative measures. Learning tools such as portion control, mindful eating, and consistent exercise regimens will reduce the risk of you becoming a statistic. If you implement some type of plan to protect your heart, you could avoid cardiovascular disease altogether. Exercise is a key component to health. Cardio type of exercises helps in reducing your risk of cardiovascular disease, along with a healthy diet and taking preventative measures to make sure your heart is healthy. I hope you have found this information valuable and thoughtful. Healthy body, healthy mind. This is Dietary Pathways, your path to nutritional health.